I'm now going to demonstrate providing Peri care for a female. This is a mannequin skill. You will always do this skill on a mannequin, so you will never have to worry about anything. Skill mannequin. So I'm going to start my beginning procedures. Hi, Mrs. Smith. My name is Patty. I'm here to be your CNA today. I'm here to perform a perineal care. Is that okay? I see your bed is locked in its lowest position. Your call bell is within reach. I'm going to pull your curtain closed for privacy. I'm going to gather my supplies and wash my hands. So for this skill, you're going to need a basin with water. You're going to need 4 washcloths, 3 towels, a protective barrier, and soap, and gloves. All right, Mrs. Smith. We're going to get started, okay? So I'm going to pull her covers down to between her hips and her knees. They don't need to be any lower than that. I'm going to use a towel to provide extra protection. So, of course, we're dealing with a very personal area, so we want to make sure that we're providing as much protection as possible. So I'm going to pull her gown up as I pull her, as I drape her with the towel. So I make sure her gown is out of the way, but she's still covered. Okay. So my next step is going to be to place a protective barrier underneath her. This one is disposable. There are cloth ones that are reusable, but generally with protective barriers, the white side is going to be the side that's absorbent. It's the side that's going to go against the skin. So I'm going to ask Mrs. Smith to lift up, and I'm going to slide this underneath her. Okay, Ms. Smith, on the count of 3, I'm going to have you lift, and I'm going to slide this underneath your buttocks. So 1, 2, 3. You have to make sure that the protective barrier is underneath the edge of the buttocks, but it doesn't have to be perfect. And it doesn't have to be up here. It just needs to be up underneath the buttocks. Okay, so to get started, I'm gonna wet my washcloth. Oh, nope. Mrs. Smith, I've tested the water and it feels comfortable to me. Do you mind testing it to make sure it feels comfortable to you? Excellent. I'm gonna wet my washcloth. I'm gonna apply soap. Again, using the 4-fold method. I'm going to show you something a little different this time. So I have soap in my washcloth. I'm going to expose. I'm going to wipe down one side of the labia, cover her up, and to get to a clean portion of my washcloth, I'm going to flip down one corner. So now I have a clean portion of my washcloth to do my next wipe. So the next wipe, I'm going to expose, wipe down the other side of the labia, cover, fold down to a clean area of my washcloth, and now I'm going to wipe down the middle of her labia. So I've done 3 wipes, always front to back. You always start at the top and wipe down. Front to back is very important. I'm going to discard of this in the linen hamper. I'm going to get my rinse cloth. And the same thing, using the 4-fold method, I'm going to rinse her using front to back motions, using a clean portion of the washcloth with each wipe. Front to back. Always covering her up while I'm manipulating my washcloth. I only expose her while I'm actually doing something. Front to back the other side. Clean portion of my washcloth. Front to back down the middle. I'm going to discard in my soiled linen. And I'm going to get my towel so I can dry. Again, front to back motion. Front to back, using a clean area of my towel. Front to back. Using a clean area of my towel, front to back. So I have completed cleaning the front portion of her peri area. Now I'm going to need to turn her on her side so I can clean the back. So I'm going to turn her towards me. On the count of 3, Mrs. Smith, I'm going to turn you on your side. Notice I've already pulled my towel over, so when I turn her on her side, the towel should drape and cover her and still protect for privacy. On the count of 3, 1, 2, 3. Normally I would move around to the other side of the bed to do this, but so you can see everything, I'm going to do it from this side. So while she's on her side, I'm going to grab my washcloth, wet it. I'm going to apply soap, and with the back side, front to back is still important, so you have to start from between the legs and work toward the top of the buttocks crease. If the term crack up helps you, remember, that's a perfect trick. It helps a lot of students. So you're gonna start wiping from the middle of the legs up. So you're still moving from the front of the body to the back. So I'm going to expose her. I'm gonna wipe up one side, cover her up. I'm gonna clean area of the washcloth. I'm gonna expose, wipe the other side of the buttocks, clean area of the washcloth. And then my last wipe is gonna be directly over the rectal area because that is required for this skill. So that is my wash step of the rectum, of the buttocks. I'm gonna get my next washcloth, I'm gonna get it wet, and now I'm going to rinse using the exact same method, starting from between the legs, moving toward the top of the buttocks crease. One side, new side of the washcloth, other side, clean side of the washcloth, and up the middle, rinsing the rectal area. Into my soiled linen. Now I'm going to dry using the same technique. Always starting in the middle, drying up. Yep. Using a clean side to dry. And then drying the middle. Soiled linen. Before I turn her back, I'm going to go ahead and remove this protective barrier just to make life easy. All right, Mrs. Smith, I'm going to turn you on your back. 1, 2, 3. I'm going to remove the protective barrier. I'm going to discard of this in the trash can because it's disposable. If it were linen, I would discard of it in the linen hamper. I'm going to pull her gown back down while I remove the extra towel that we use to provide privacy. This is going to go in soiled linen. We're going to put her blankets back in place. All right, Mrs. Smith, I've completed your perineal care. Your bed is still locked in its lowest position. Your call bell is within reach. Is there anything else I can get for you? All right, I'm going to open your privacy curtain and I'm going to discard of my supplies. Privacy curtain open. Now I'm going to discard of my water in the toilet. Going to rinse. And now I'm going to dry before placing in the soiled linen area. Do not remove your gloves before you put everything in your soiled linen area, in your soiled dirty supply area. Most people want to say, well, I've touched the perineal area, I have to take my gloves off before I can touch anything else. In the lab and for testing, we suspend reality with that. You can use the same pair of gloves through the entirety of the skill start to finish. You don't need to change your gloves at any point. But at the end, once you have empty, rinsed, and dried your basin, you will need to remove your gloves. Verbalize washing your hands, and your task is complete.